In the meantime, health experts are bracing for a possible surge in travel-related cases following Thanksgiving. With the December holidays weeks away, the CDC is again recommending people cancel their plans. And so this morning we are joined by Dr. Nasia Safdar, Medical Director of Infection Control at UW Health. And Dr. Safdar, thanks so much for your time this morning. We really appreciate it.
Thank you.
So let's talk about this possible surge in cases. I think my family did what many families did. It was just us. It was very small. We Zoomed with family. And my mother-in-law said, I hope this means we can get together for Christmas. Why is it that we already know that we can't get together for Christmas?
Well, I think that we've seen that most of the transmission of COVID-19 is happening through gatherings, and the holidays are a perfect time for people to come together, especially, members of the family who haven't seen each other for a while. We know that Thanksgiving was a big risk for that happening, and the upcoming holidays will also encourage people to do that. But given that, there's light at the end of the tunnel, there's a vaccine on the horizon, but it isn't here yet. So we still have to be very, very careful until we have a more permanent solution in place.
And doctor, following Thanksgiving last week, are we still anticipating a greater surge in cases in the weeks to come here?
I think we probably are bracing for that. I think it's a little bit encouraging that a few days have gone by since Thanksgiving and we haven't seen, an additional huge surge in cases. But of course, if we're not out of the woods yet, you can still, have a couple of weeks after Thanksgiving, and even after, you might still see additional cases. So slightly encouraged perhaps, but still worried.
So Dr. Safdar, you talked about the vaccine. There's a meeting on the 10th. How soon after that do you feel that frontline workers here in Wisconsin could have access to the vaccine?
I think very soon after that. Once the vaccine is approved, in the matter of a few days, I think we could have the first shipment of the vaccine available. And then health systems around the state and others who will be distributing the vaccine have already prepared their plans and are ready to hit the ground running.
Some people are hesitant to receive this vaccine. Some believe that maybe it was developed too quickly. What do you say to people who are nervous about this vaccine?
I think I can understand why people might feel that way, because it is a departure from how vaccines typically get approved, in the sense that we're used to it taking a long period of time. But it doesn't have to take that long period of time. Most of the time that needs to be spent is in developing it and then testing it for safety. The review process, having those areas streamlined, could be done and have been done for this vaccine. So it's not like any corners have been cut or any things haven't been done that should have been done. It's just been on a very streamlined, efficient, and effective way, which is how I think vaccines should move in the future as well.
And Dr. Safdar, would you get the vaccine?
I would, absolutely.
Okay. Well, thank you so much for your time and your expertise with us this morning.
Thank you so much.
Well, to check the coronavirus numbers in your area and learn where you can find free testing, head to tmj4.com/coronavirus.